Nestled in the hills of southeastern Indiana lies picturesque rural Franklin and Ripley counties. Amidst the cornfields, streams, church steeples, schools, and breathtaking views, there are 51,000 residents. This part of rural Indiana is known for its strong work ethic, family values, devout faith, and fried chicken. In spite of the strong working population, however, there are over 6,000 people who have an income below poverty level and who do not have health insurance. For people like Mary Ann, lacking health care is not just a problem for her family, but for all of us. No community can be truly healthy if a significant portion of the population is excluded from basic health care services.
I've been employed for 11 years. My employer, nor does my husband's employer, offer health insurance. I just get worried with anything like cold, strep throat, things like that that I may have to go to urgent care or ER for that I can't afford. With my 3 kids, I worry a lot about their health care, and this clinic is very important to me.
Every day in the office I see people who cannot afford medical care. Many of them don't adequately treat their chronic illnesses because of cost. A local group is trying to solve this problem in the form of this free clinic, but we need help. And we need lots of help because it's a very big need.
Dr. Steve Glazier has served this community as a general practitioner in Batesville since 1978. He frequently sees patients who have difficulty paying for their medical care. Many working people in this part of Indiana cannot afford premiums for their employer's health insurance plans and do not meet financial requirements for Medicaid. Because they lack health insurance and money, they are often unable to get necessary tests or treatments. As a result, many chronic illnesses like diabetes, asthma, and heart disease are inadequately treated, and acute illnesses are untreated except in the emergency room.
My name is Dr. Stephen Stein. I'm a retired orthopedic surgeon. I moved here about 8 years ago actually, and I practiced for 30 years out of state. When I moved here, I found it interesting that there was no care or ability for poor people to actually get health care, or those people without health insurance. It was strange to me because I came from a big city where the counties had responsibility to care for the people who couldn't afford health care.
Dr. Glazier learned of a health clinic in a surrounding county and has been volunteering there for 3 years. It became apparent to him that Ripley and Franklin counties could also benefit from a free or low-cost health center. He spoke with other local health professionals who have joined with him to develop the nonprofit Southeastern Indiana Health Center to serve the working uninsured. Together, they have been working with Volunteers in Medicine, a national nonprofit organization that has been opening health clinics for those in need throughout the U.S. for the past 20 years. The executive board for the SEIHC includes Dr. Steve Glazier, Dr. Michael Parker, Dr. Steve Stein, nurse practitioner Bev Metz, Pastor Roger Dean, Geraldine Litzinger, Connie DeBerger, Pete Mack, and Linda Tuttle. Southeastern Indiana Health Center will use the culture of caring model, which is the heart and soul of a Volunteers in Medicine clinic. We believe that the way people are treated during a visit to the health center is as important as the medical care they receive. Southeastern Indiana Health Center seeks to heal not only physical illnesses, but also the injury caused by bias, prejudice, and indifference. Patients will be welcomed and treated as friends and neighbors, good people in need of help, not as illnesses and diseases. Although the recent passage of the historic healthcare reform legislation will provide relief to some of the uninsured, community safety net clinics will be necessary for many years to come. The escalating cost of health insurance and medical care, as well as cutbacks in Medicaid, are just a couple of the factors that contribute to the growing need for a local health center. Volunteers in Medicine has found that 70% of the people they serve are working adults and 20% are children. Southeastern Indiana Health Center will be funded by financial contributions, in-kind donations, planned giving, and grants. It will be staffed by volunteer medical professionals and support staff. We rely on the community to help open our doors to those in need. Together, we can make this happen. Imagine quality medical care available for all residents of Franklin and Ripley counties. The young, the old, the poor, the weak, the strong. All will be treated with dignity and respect, regardless of race, culture, or religion. May we have eyes to see those who are rendered invisible and excluded, open arms and hearts to reach out and include them, healing hands to touch their lives with love, and in the process, heal ourselves. Southeastern Indiana Health Center and Volunteers in Medicine operate by several standards. The Golden Rule: do unto others as you would have done unto you. The Second Commandment: love your neighbor as yourself. No act of kindness, no matter how small, is ever wasted.
At the end of the day, it's not about being a taker, but it's about being a giver.
We need your help in healing the medically underserved in our community. Will you help? By working together, we can make our friends and neighbors in Ripley and Franklin counties healthier. Can we count on you?